my name is Addison, and I will be arguing on the affirmative side how the government should establish healthcare system. I want to bring an incident that happened I want to say a year or so ago about my brother, and he had gotten in a car accident. It was his first time getting his car, first time on the road, and he had stopped at a train station, or as trains were going, and a car rear-ended him, and he ended up having to go to the hospital because he couldn't really move his neck. And so he stayed there overnight, and then the next day he got discharged from there. And they sent him his his bill, and of course he has insurance, but of course it didn't like fully necessarily covered everything, and he was just left with a bunch of money he had to still pay off. And of course my parents were have some compassion with my brother. Obviously there's his son, so they paid it off for him. But I want to just dive in that 26 million American citizens do not have access to healthcare insurances. And this is a fatal issue that should be resolved, because those 26 million citizens could be at risk of a disease or illness that could be detrimental to their own lives. An incident like these, where stuff happens in life and life is just unpredictable, and any given moment you might be just fall into death. And a lot of people talk about how you don't want to fall into debt, and you don't want to just kind of work your entire life trying to pay it off. And yet some of these people are left untreated because they don't have the insurances to cover the necessary medical treatment, or even the doctors to help prevent those illnesses or conditions. So I did get into a little more research about healthcare, and I found the website Worcester School stated not having healthcare causes around 44,789 deaths per year. Sorry. 44,789 deaths per year means there is a 40% increased risk of death for people who are uninsured. However, those who oppose the idea of free healthcare insurances fear that taxes would rise, quality of medical care would reduce, and may become riskier for those who are in need for actual proper care. Although these concerns are valid and reasonable, especially we're hitting a rough patch in time where the gas prices are rising, and as well as market pricing is going up, and a lot of families are struggling to maintain stability for their families. Let's just take into account that we're in the process of recovering from COVID-19, the outbreak, and free healthcare could help reduce these widespread of COVID-19, which may allow for small businesses to open back up again, and just to let our work industry thrive. So additionally, free healthcare provides treatment that the individual needs to recover. Many American citizens' insurances are affordable for their wages, but most of the time their insurances doesn't cover the treatment they actually need, and that's a problem of itself. So I believe the most effective plan to encourage free healthcare costs is to make it affordable for citizens to thrive as they become healthy human beings, as to put in place the single payer system, which is every citizen must pay for public health insurance programs. This allows citizens to have offers that each individual has greater control over their health care, providing the ability to choose from their doctors based on the approach and reputation. Sounds great, right? Well, I want to show and demonstrate how successful the single payer healthcare has made on South Korea's structure on the system, the choice of who receive these coverage, and the policy mobilizing financial resources for the system. So it's funded through the combination of government subsidies, the outside contributions, and then the tobacco charges, which the coverage covers about 50 to 80% of medical costs, which includes medical checkups, general procedures, accident at coverage, and prescription medication. They as well planned for private coverage for those who are foreigners, which I find that awesome. So in the website I found called the CT Mirror stated South Korea provides national health insurances to all citizens throughout the National Health Insurance Corporation under the Korean Administration of Health Wellnesses. So it's financially by a average 5.06 payroll deduction out of the monthly income, splitting between the employer and the employee. So my Self-T plan would encourage to make a single-payer healthcare system put in place in America, and the administration would represent at the federal level to propose the medical benefit and push the idea of Medicaid, which is like kind of similar to the single payer system, and also mandate the nationwide to facilitate the amount of fundings towards the single payer healthcare system. So basically, additionally, if the state do not want to accept the federal funding, then ultimately the states don't have to adapt to the single payer system, and much like states currently participating in Medicaid program. The single payer systems would cover over the healthcare services and such as dental, visions, and hearing, which most of the time Medicare coverage doesn't cover those followings. So those services could be covered for anyone under a single payer system. So wrapping up, my single payer system encourages a universal health care coverage, which is to allow citizens to have free access to medical help that is up to them based on their perception and condition. And let's take into account that there are families that are struggling to survive, families that don't have anything other than each other, and those families shouldn't have to suffer trying to make money in order to live. Especially their health should be a human right. Like all the necessities of having to walk, breathe, do everyday living, that should just be a human right. I don't believe that you have to buy to keep up with things, keep up with those things and conditions. So as a nation, we should come together and help our neighbors. A universal health care coverage isn't a perfect plan. It may have major setbacks. However, this plan may save lives, become another resource for families to regain stability, and become another step forward to regaining humanity in our world today. Thank you for listening to my video.